All right, thank you so much for staying with the Monday Report. Town Hall session begins right now. Send in all your questions in terms of the vaccines that's supposed to land in Kenya tomorrow at 12 a.m. That's technically Wednesday, but it's at 12:05. So we'll distribute about 1.25 million Kenyans. That's what they say. Let me bring in my guest real quick. Professor Walter Jaoko is a professor of medical microbiology and tropical medicine at the University of Nairobi. He's also the director of CAVI, which is Kenya AIDS Vaccine Initiative. His Excellency Oded Joseph, Ambassador of Israel to Kenya, could not make it. He sent in his apologies. We wanted him to give us the view from outside there. He's not going to make it this evening. Simon Mushene Njoki, a vaccine recipient in Dubai, is a Kenyan but he's in Dubai. He'll be speaking to us later on his private experiences, as well as Julia Nyamurwa, who's a clinical nurse and manager at the hospital, University of Hospital Coventry in Warwickshire. That's in the US. But let's start off with the professor. Prof, thanks for making time for us. So, you know, there are a lot of people who now think that since the vaccine is here, we can all now breathe a sigh of relief. Is this the end of our COVID-19 problems?
Thank you, Trevor. No, this is not the end of our COVID-19 problems. Actually, we keep on saying that a vaccine is just an additional tool to the existing tool that we have. So the social distancing, the washing of hands would be strengthened by using a vaccine. But the fact that we get a vaccine does not mean that we throw all the other preventive measures.
So, Prof, are you saying we will still have to wear masks even if everyone has been vaccinated? Prof?
So until we control transmission, which we, now that because the question was that now that the vaccine has arrived, we just throw away all the other measures that we already have in place. I'm hopeful that that time will come, but it is not now. Once we cut down transmission, we will then be able to remove our masks, and I'm hoping that some habits that we've developed that are still very useful for control of other infections like washing of hands will continue.
So, Prof, we only have 1 million doses coming in and we have 47 million Kenyans. That's pretty much like 1 in every 50. Is that enough?
No, it's not enough, but we should realize that there is actually a shortage of these vaccines globally. It's not just for Kenya. But I must commend the government of Kenya because they are going to give the vaccines in 3 phases. So this is just phase 1. We are then going to have phase 2 where they target to vaccinate 9.7 million. And then we're going to have a phase 3 where they'll hope to target another 4.9 million. And so in total, we'll be having about 15 million people vaccinated. And that is a good percentage. And in a country where the transmission is not as high as in Europe or South America or even North America, my belief is that that would be sufficient numbers.
So how long will this protection last?
Now, that is the $1 million question. Nobody really can tell you for now. This is a new vaccine. It's a new disease. Even in the countries where they have given a very huge coverage, like Israel, with more than 50% of its population vaccinated, nobody can really tell you how long this will last. We are hoping that it will last a long time. We are hoping it can even be a lifetime, like the yellow fever vaccine. But at now, nobody can tell you.
So this first batch that is going to be immunized now, and then there's the next batch would be somewhere in June. When that next batch comes, should we focus on the guys who've not been immunized at all, or should we focus on the team that was given the first jab and now are requiring the second jab?
No, actually the focus will be another group. If you look at the plan that the Ministry of Health has, they're targeting different groups. So phase 2, that will be coming in June, will be targeting a different group. At the moment, the first group will be healthcare workers. That will be first priority, followed by what we call frontline workers, who are the security personnel, the teachers, and so on. And then we'll have people in the hospitality industry, and that will take care of phase 1. And then the phase 2 will be targeting a different group. And finally, phase 3 will open it up to another group as well. So we will not be vaccinating the same group of people.
So, based on the experience that you have, what is a sufficient number? You mentioned 15 million, but we are 47 million Kenyans. Should we strive to vaccinate at least 70%, 80%? What is the sufficient number to now say that we are safe from COVID-19?
In most infectious diseases, we talk about 60%, but it also depends on the intensity of transmission. As we know that in Africa, the intensity is not as much as in Europe or North America or South America. What we will be doing, hopefully, with the vaccination, we will be monitoring transmission. And we might even reach a number that is less than the 15 million, and we find that transmission has completely been cut off. So I'm hoping that realistically, we should say about 40% of the population. That is what you would expect normally. But in a situation where the transmission is not as intense as in Africa, my suspicion would be like 30% should do it. But as I said, these are guesswork. And what we need to do is just continue monitoring it even as we vaccinate.
So when the vaccinations begin, should we now reopen our economy?
Not at the beginning. That is the hope that once you give the vaccines and you're able to reduce transmission, and you can be able to monitor that, and you see new infections are coming down, admissions are coming down, then you'll have to begin opening the economy. And that is what has happened in Israel. In Israel now, people are going to the beaches. They have been allowed to mingle. They've been allowed to open up their businesses. Schools are operating. In the UK, they have a projection. They're saying from the gradually increasing the numbers of interaction at the moment. Even in social gatherings, they only allow 8 people. But the projection is that in April, they'll start opening up the space, and it's because of the vaccination. So as they monitor and they see the transmission being cut down, they keep on opening up the economy.
There's a question here from David Iraki, who's wondering, is the vaccine effective to the new type of COVID, or is it only effective to the old COVID type?
So the information we have at the moment is that the vaccine is effective against the three main strains of variants of COVID virus. The evidence at the moment is that the vaccine is effective against those. But the situation that we need to keep on monitoring. We don't know whether things will change, or whether a new variant that is actually not controlled by the vaccine will even emerge. So this is a new area. There's a lot of unknowns. There's a lot of studies. There's a lot of observation. There's a lot of being alert, and surveillance is the key.
Wait, did you say that a new virus could emerge?
Oh yeah, a new variant, a different strain of the COVID-19. Could emerge, just the way the South African and the UK and the Brazilian strains emerged. Another one can emerge. It is that is the nature of viruses. They keep on as they multiply, they make mistakes, and when they make sufficient mistake, that results in a new variant of the same virus.
And what usually happens in that case? Does that then mean that the current vaccine will not be effective and it will be more virulent, or it's something we have to wait and see?
We just have to wait and see. So when you get new strains or new variants of the virus, there are several things that it can cause a problem. One, it can escape. We call it an immune escape. It can escape the vaccine, so that the vaccine is no longer able to control it. Two, it can be that it is much easily transmitted, and that is what we have seen with the South African strain of COVID-19. Three, it can cause more severe disease than the old strains, and there is no evidence at the moment that this is the case with the variant. And the fourth thing is that it can even escape detection in terms of diagnosis, because the diagnosis is based on a part of the virus. So if that part of the virus mutates and changes, we have to develop new diagnostic methods as well. So none of the things that I've mentioned, the only one that we are now sure that is happening is the increased transmissibility, the fact that the strains that have emerged are much more easily transmitted, but not the others, not resisting the vaccine, not having challenges with regard to diagnosis, and not causing severe disease.
Prof, it sounds to me like this is a gamble we are taking. Why should one take the vaccine at all?
Oh, you need the vaccine. Trevor, you need the vaccine. And that is the gospel that we should be preaching. That, as I said, the countries that have really been drastic, by taking the vaccine, they've been able to reduce transmission. They've been able to reduce the number of severe diseases in hospitals. So they're freeing up hospital beds. And we need the hospital beds for other disease conditions. There are many people with the renal diseases, there are people with cancers, there are people with other conditions that require this bed. So vaccination is the key. It reduces transmission, it reduces severe diseases, it opens up the economies, it opens up traveling. If you don't get the vaccine, it will reach a point where you will not be able to go to certain countries. As I'm sure you've heard about the proposed passport where you require vaccination. So I think those who will resist the vaccine will regret in some years to come.
But what about people who've contracted COVID and have healed? Should they also get the vaccine?
Oh, yes, they do. So again, this is another new area. What we know is that when you become infected, a number, not everybody, develops some level of immunity. But we know that that immunity wanes, it disappears with time. And again, we don't really know how long it takes before it disappears. But we know that there are people who have been infected more than once. I personally know a friend of mine who has been infected twice, who got infected, recovered, and a few months later got reinfected again. So we know for sure that natural infection does not give you protection, and we know that even if it gives you protection, it might be very short-lived, and so therefore they should be vaccinated.
And Engineer Lazaro Kanyamboko on Twitter is saying that my concern is how the drugs will react with our bodies. How will they help those who develop resistance?
Unfortunately, I don't understand the question. Resistance to what? Resistance to the vaccine? Resistance to... it is not very, very clear.
So he's wondering how this vaccine would react with other medications. For example, if are you taking other drugs? What if you get the injection? Will there be a reaction to that?
Okay, no. So this is a message I keep on trying to communicate to people, that the way drugs work and the way vaccine works are two very different mechanisms. Drugs, when you take drugs, it is the drug that goes to fight the germ. It is the drug, the chemical itself that goes to fight the disease-causing germ. But vaccines act in a different way. Vaccines stimulate our bodies so that our bodies develop weapons to fight the virus. So the vaccine just comes for a very, very short period of time. Once it stimulates your body, it disappears. So it only leaves your body now well armed to fight the virus. So in actual fact, vaccines support the drugs. So if a drug is fighting the disease-causing germ, then the vaccine comes and stimulates your immunity to support the fight against that particular germ. They work complementarily. So I don't see a situation where a vaccine will counteract a drug.
So, Prof, when we say that when we vaccinate like 40% or 60% of the population, then that is good enough, what does that mean for the other 40? Is it then deemed that they will develop their own herd immunity, or what happens?
So what you're hoping to do is this. You see the way the virus would survive if it finds a fertile ground. So when I'm infected and the people around me have no protection, the virus finds fertile ground in them to cause an infection. The more vaccinated people you have, when the virus tries to move to infect somebody else, it finds that the other people have a level of protection, and therefore it cannot cause the infection. And now remember, something called herd immunity, that the number of people who have been vaccinated, preventing the virus from getting a fertile ground, is sufficient to prevent transmission even amongst the people who have not been vaccinated, because the virus then disappears.
So, Prof, the last time I went to take a flu shot, I was told that you must not have any symptoms of a flu if you're going to be given a vaccine. And this is a situation where COVID-19, some people are asymptomatic. Should they still get it, the vaccine, even though sometimes they may be infected, or should people be tested first before they get the vaccine?
No, you don't need to be tested. So you remember, what you're told is that if you have symptoms, so that is different from being symptomatic. So even the regular vaccinations that we get, I'm sure you've heard about children. So for example, when children are getting child vaccinations, and you take your child for vaccination, you didn't have a at all. And so that is not a problem.
Okay. I see there's a question here from Grace Story Teach. She's wondering, since a virus does not get out of the body completely, does this mean we shall be vaccinated after some time or forever?
Thanks for. I am not very sure about that, about the virus not getting out of the body completely. It is not true. There are some viruses that when they get into your body, they stay, they last there, but it's not all viruses. So for example, we are all familiar with the common cold that is caused by viruses that we call rhinoviruses. But once you recover from the cold, you don't have the virus. But then there are some viruses that stay in your body, like there's one called varicella zoster virus that causes a disease called shingles. That goes and stays within your body, and it is only when your immunity is lowered, then it gets a chance again to multiply, but your body keeps it in check. So it's not that all viruses do not get out of the body. There is no evidence that COVID does not get out of the body. The people who have recovered from COVID do not have the virus in their body.
All right. Thanks, Prof. Let me bring in some video questions that are coming through before I read some of the Twitter questions here. Let's bring up the first one.
If I had the disease, do I need to get the vaccine? And secondly, after vaccination, can someone transmit the disease? Thank you.
Prof, you'd answered the first part of that, but the second part you did not. If after vaccination, can someone still transmit the disease if they get infected?
Okay, so that is one of the things that we are still getting information about. Data that has just come at the end of February regarding AstraZeneca vaccine. They did some analysis in the UK, and now there is evidence that the vaccine also protects it from transmitting the disease.
Okay, let's bring up the next question.
Why aren't they concerned doing vibrant public sensitization about the vaccine such that by the time it gets to us, we already know what it's all about, what the vaccine is all about, its pros and cons, side effects, its safety, and what will happen should it not work on us, such like.
Prof, what is the most effective way of communicating about vaccines that is new to people?
Yeah, I agree with the gentleman about publicity, sensitization of the general population, but I think the government has done a good job. I think probably what we need to do is to go to the community level. I think a lot of it has been done centrally, has been done through media. But I think what the gentleman is saying, can we have barazas, for example? You remember when HIV first came into the country and it was declared a national disaster, then whenever there would be a baraza, for whatever reason, in the communities, even if you're going to discuss cattle dip and issues of of controlling infections by use of cattle dip, before the meeting would begin, to talk about cattle dip, they would sensitize people about HIV, telling people about how the HIV is transmitted and what they need to protect themselves. So probably that is the approach we need to take, so that wherever there is any meeting in the rural areas, in the communities, that the sensitization about COVID vaccine is first given, and then you go into the meetings. I think that is what the gentleman is talking about, and I can't agree less that sensitization, when people get the right messages, then they can be able to choose for themselves whether they want to get the vaccine or not to get the vaccine, but they can make a choice, what we call an informed choice. They know what the issues are, what the facts are, but then ultimately the choice of whether to be vaccinated or not is theirs. As human beings, you have autonomy, you can decide for yourself, and that decision has to be respected.
Okay, Jacob Abere Matlala is wondering, how effective is COVID-19 vaccine to pregnant women and children?
Thank you, Justin. So the thing about testing products, new products like vaccine, a COVID vaccine is a new product. You cannot test it in pregnant women. And at the moment, the priority is actually on adults. The reason being that although children are affected, they tend to fight the infection much more easily than the adults, and especially the older people. So the studies that have been conducted so far have been in adults, 18 years and above, and it has not been conducted in pregnant women for ethical reasons. You cannot conduct any new product like vaccines or drugs in pregnant women.
Okay, let's bring up another video question.
How will this corona vaccine help, for example, the people who are living with the diseases such as diabetes and other underlying conditions, in order for them to survive for the time being and not die? Will it have the negative effect?
Prof?
No, actually, those are what you call the priority areas. So one of the populations that we want to give the vaccine are people with what you call comorbidities, like diabetes and hypertension and cancers, what we call malignancies, because when these people get COVID, it tends to be more severe, and so therefore they are in the priority list. And there is no evidence whatsoever that these populations will be affected differently from the general population. The clinical trials that have been conducted in all the vaccines that are being used now in what we call emergency authorization have included this population, and there have been no evidence that they get any serious side effects compared to the general population.
All right, let's bring up another question.
Are we going to have minimal cases of COVID-19, or are we saying that once the vaccine is introduced into the body, then there is completely no case of the virus upon this person who has been vaccinated?
Prof?
Okay, so the vaccines have different ways in which they can be effective. Number one, you can have a vaccine that completely prevents you from becoming infected. You can have a vaccine that you'll still become infected, but it prevents you from getting a severe disease. So it in a sense converts you from the worst case scenario of getting severe disease, needing hospitalization, being put on oxygen, being put into intensive care. So, which is a good thing. So you get a vaccine, you still become infected, but it doesn't progress to severe disease, so you recover. And that is a one benefit of a vaccine. What a vaccine can be, in addition to preventing you from becoming infected, or in addition to preventing you from getting severe disease, it also prevents you from transmitting that infection to somebody else. And so at the moment, there is a spectrum. The vaccines that we have seem to work across that spectrum. That in some situation it prevents them from being infected. In some situation it prevents people who are becoming infected from getting severe disease.
Okay.
And as I mentioned just at the beginning of the program, there is now evidence coming from.
Okay, let's bring back another question.
What is the effective percentage of the first COVID-19 jab? And my second question is, if you're given the first COVID-19 jab, then you miss the second one, how safe are you?
Prof, what happens if you miss the second one?
Yeah, so our hope is that you don't miss the second one, and people are looking at these scenarios because, as you know, vaccines that you have to give twice have their own issues with regard to compliance. But the studies from the UK are now showing that by getting a single vaccination, you protect about 76% of the people who are vaccinated. As to how long that protection lasts is another research question.
Okay, I think we have another question.
Are there some side effects that are brought about by this jab? And if they are, are they easily manageable? Do we have a solution to them? Thank you.
Prof? Oh yes, thank you for that question. Actually, that is the whole basis of a vaccine. The vaccine would not be licensed for use if it had any severe side effects. So all the vaccines that have been licensed for use is that they have mild side effects, and these side effects resolve with time. And usually, they say within few hours, the vaccine side effects have disappeared.
Okay, I see Engineer Lazaro Kanyamboki is also asking, America vaccinated almost half of our population and still leading the whole world in mortality rate. What could be happening?
Actually, America has not vaccinated half of its population. They're still vaccinating. They're hoping that they'll be able to reach a significant percentage. They still have prioritized the elderly people, the healthcare workers. They haven't reached yet into the general population. But America is a big country. Different states have different ways in which they are prioritizing who to vaccinate. We still have to wait and see. I think the best scenario is Israel, which has vaccinated more than half of its population, and the effects are tremendous. It's unfortunate the Israeli ambassador is not able to come to this program, but should have shared with you the tremendous benefits vaccines have brought to his country.
All right, Prof, thank you so much for making time for us. We have to take a quick break now. When we come back, we get results from people who've actually gone through the vaccine and gotten it. That is Professor Walter Jaoko, Professor of Medical Microbiology and Tropical Medicine, and also Director CAVI, Kenya AIDS Vaccine Initiative. We'll come back to him for just closing remarks in a bit, but for now, we're taking a quick break here. You can still send in a few of your questions. We'll pose them to the professor shortly, but when we come back, we'll also have Simon Mushene Njoki, who's received a vaccine all the way in Dubai, but he's Kenyan, so he'll tell us his experience. All right, see you in a bit.